Hi everyone, welcome back in today's video. So in this tutorial we shall be discussing common cause of irregular period. So why do women miss their period? Is this a question that you ask yourself? So the answer is yes. So before we dive into our tutorial, I would like to give a brief overview some medical terminologies related to irregular period. So the first one we have is amenorrhea. So amenorrhea means absence of menstrual period. Number two, we have dysmenorrhea. So dysmenorrhea means painful menstrual period which include severe cramping. Third, we have oligomenorrhea. So oligomenorrhea means infrequent menstrual periods, usually more than 35 days apart. Fourth, we have menorrhagia. So menorrhagia means heavy menstrual bleeding. So please, I request you kindly, if you're new member to this channel, kindly hit the subscribe button, like and share, and give your comment to this video.
Everything we were, don't make us who we are. So I'll dream until I make it real, and all I see is stars.
During a normal menstrual cycle, an egg is released from one of your ovaries during ovulation. If the egg is not fertilized by a sperm, then gender hormone levels send a signal to your body to shed the blood or the tissue that line your uterus. This bleeding typically lasts about 5 days. Then a normal monthly menstrual cycle repeats itself. But some women have something what is called abnormal uterine bleeding, which is another term for irregular periods. So irregular periods can happen for a variety of reasons. For instance, stress, lifestyle factors, or a serious underlying medical conditions. So in this video, I am going to explain to you the reasons that behind late period, missed period, or irregular period. So what is an irregular period? An irregular period is when the length of your menstrual cycle falls outside the regular range of your monthly cycle. So this can happen a number of reasons. So irregular periods can include, for example, abnormal uterine bleeding, such as bleeding between periods, bleeding after sexual intercourse, bleeding during menstrual cycle, menstrual bleeding that lasts longer than normal, bleeding after you have reached menopause. After puberty, many women have a regular menstrual cycle. However, it's normal for the cycle to vary each time after a few days. According to the American Academy Family of Physicians, about 9 to 14% of women have irregular periods between their first period until menopause. Common cause of irregular period or missed period or absence of period include the following. Irregular period can happen due to a number of factors, which include the following. The first one is uncontrolled diabetes. So if you have uncontrolled diabetes, you may have irregular period. This is because there is interaction between your blood sugar level and your body hormones. So it's possible for you to have irregular period. Number two, eating disorders. For example, if you have eating disorders such as anorexia or bulimia. For instance, you are someone who is having poor appetite, so you may undergo a weight loss. So if you are someone who is underweight, too much slim, so you may have irregular period because your body is not producing enough hormone to control your regular menstrual cycle. At the same time, if you're someone who is overeating, for example, if you're overweight, if you have an overweight, you may also have irregular period because this can disrupt the normal functioning or the normal production of hormones in your body, which may disrupt your normal menstrual cycle. So eating disorders can cause irregular period. Number three, hyperprolactemia. So if women have too much a protein hormone called prolactin in their blood. So they can have irregular periods because there is increased elevated level of prolactin hormone in the blood, which can disrupt the normal menstrual cycle. Number 4 is polycystic ovarian syndrome. So polycystic ovarian syndrome is a disease which occurs when there is imbalanced sexual hormone, especially androgen. When the female sexual hormone produces excess male hormone, that is androgen, so there will be a disruption in the menstrual cycle. So polycystic ovarian syndrome can cause irregular period or missed period or painful period. Number 5 is a premature ovarian failure. So the ovaries of a woman with premature ovarian failure can stop working before the age of 40. According to the National Institute of Health, many women may have disrupted period during this time, and some women can have occasional periods. Number 6 is certain medication. For example, if you are using anti-epileptic or antipsychotics medications, you may have irregular period because this medication can disrupt the normal cycle of your menstrual cycle. So this medication may have an impact of your menstrual cycle. Okay, number 8 is stress. So stress hormones can disrupt the normal cycle of your period. So prolonged stress can also cause for you to miss your period, or it can disrupt the normal production of hormones in your body. Therefore, you may have irregular period. Number 3, uterine fibroids. So uterine fibroids, these are growth that occurs on the walls of the ovaries, which may form a cyst which is filled with fluid. So this can cause for you to have painful periods, heavy bleeding, or absence or missed of periods. Number 9 is endometriosis. So endometriosis is a condition which occurs when the lining of the uterus grows outside of your uterus. So this can cause disruption of your regular menstrual cycle, which you may feel have painful periods, heavy bleeding, or absence of period. So these are a number of factors which can cause for you to have irregular period. So whenever you experience such symptoms, it is good for you to consult and see a gynecologist, a medical doctor who specializes in the treatment of medical conditions affecting the female reproductive system. So he will give you counseling and the best treatment for your disorder. So thanks for your watching. Have a nice day.